Freud used a set of theories and therapeutic techniques in his experiments with his patients called psychoanalysis. It was used to treat patients with their mental disorders and different ailments that they have experienced, and even to this day, the modern psychological community questions its validity, whether or not it's a legitimate practice, but back then Freud used it all the time in his experiments. He believed that one of the major tenets of psychoanalysis is that a huge portion of our personalities are determined in our early childhood, rather than inherited traits. The forgotten memories stored inside our hippocampus, based in the limbic system, are a huge step in unlocking the potential traumatic events or different things that are happening with the patients. Freud would attempt to trigger certain portions of the patient's brain in order to find a solution for treatment or, other advice in that way. He would often attempt to unlock these memories, potentially using free association. He would inevitably trigger a huge influx of serotonin, norepinephrine, and dopamine from the patient. In those experiments, he would often trigger the sympathetic nervous systems as well of the patient inside of the amygdala, and attempts to bring those, drives, forms of fight or flight, self-defense, things up to the surface, activating that response. These would often help him understand the mental health of the patient and how to further treat the patient if needed.